بسم الله الرحمن الرحيم والحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين. السلام عليكم ورحمة الله وبركاته. This is a DVD course in communication skills for physicians produced by Saudi Commission for Health Specialties. First, I want to thank you for taking time to watch this video. I am Dr. Faiza Reyes, a consultant family physician in the joint program of family and community medicine in Jeddah. Today, I'm very delighted to share with you my life experience in communication skills training. I have been training postgraduate doctors in communication skills for most of my professional life. I have learned so much over these years in communication skill training, and I have lots of work in this field. I published my first book in communication skills, الاساسية العلمية للاستشارة الطبية, in year 2001, the first edition, and the second edition was in 2006. I have trained hundreds of doctors from different specialties and from different levels, in most of them from the kingdom and some from the Gulf countries and in Egypt. So for that purpose, I published Consultation Skills Course Manual. It's full of exercises, tips, tools, and techniques which help for self-training. I also published manual for trainers, and this is my website where you can find a lot of material helpful for both trainees and trainers. In this video, you are going to learn how to communicate with your patient more effectively, and how to make them more adherence to your management plan, and how to make them even more thankful to you. So let us start it. We will start by definition. What is communication skills for physicians? What do you mean by this? It is how doctor and patient interact together. This interaction, in American literature, they call it interviewing skills. In British literature, they call it consultation skills. Whatever you call it, it is the central act of medicine. Because according to this interview, or the history taking, we call it, usually doctor, they decide what sort of physical examination they are going to do and what management plan they will recommend for their patients. So if this interviewing skill is good and the doctor managed to perform good history taking, all the rest of the consultation, all the rest of his work is going to be effective and successful. But if the interview, it doesn't go well, so all the management and all other medical actions is not going to be successful. What exactly you are going to learn in this course? Whenever we talk about communication skills training, the first thing that comes to mind for the majority of doctors is difficult patients. How to deal with them and how to maintain or how to minimize their collateral damage. But what about ordinary patient, everyday patient? Do you think we need to improve our communication skills to be able to interview all patients more effectively? Because not only difficult patients need good communication skills, but every patient deserves all our skills. We will learn, inshallah, from this DVD course, a lot of skills which will improve our performance for better health outcome and for better doctor satisfaction. And as a baseline skills, we need to learn more about our patient. This is what we call it illness behavior. We are going also to discuss relevant verbal and non-verbal communication skills. And then we are going to learn how to use these skills to build effective doctor-patient relationship. When you know all these basic things and you apply it with every patient in your daily practice, I promise you, with very little effort, you can go to the last step. At this level, you will feel that you are mastering everything in doctor-patient communication. This is the 3 logical steps of learning communication. In this 3 hours DVD course, we will learn the first and the second step. The third step need another course. What is the aim of this course? As you see here, this is what we used to do in everyday practice. When we have a patient, we ask him about the chief complaints, and then we go through the details of present history and past history and all these things. This way of dealing with patient, of interviewing patient, we call it doctor-centered approach or doctor-centered consultation or doctor-centered interview. The aim of this course is to learn how to practice more comprehensive consultation model with effective doctor-patient relationship using appropriate communication skills. Okay? The aim of this course is to add more blue contents to your doctor-centered approach and to master more green skills while you are doing this. Okay? And in this course, we will learn a lot about this blue and things issues. Okay. The course objective, by the end of this course, you will achieve the following: understanding illness behavior, understanding patient verbal and non-verbal communication, using verbal and non-verbal communication more effectively, applying more effective more effective skills in establishing and in maintaining doctor-patient relationship, and applying a comprehensive consultation model in your daily clinical practice. Everyone will ask himself, what is in it for me? What are your personal benefits from this course? I will tell you. If you improve your communication skills, this is going to help you not only with the patient, it will help you even in your daily interaction with your friends, with your family, even with strangers. Improving quality of patient care will increase your self-satisfaction. If your patients are happy and they are thankful to you, this will make you happy. It will make you work with enjoyment. It is a requirement by the Saudi commissions for health specialties, and it will come in the board exam. And other things you may discover while you are going through this video. The course outline, we will cover 4 main topics: illness behavior, verbal and non-verbal communication, doctor-patient relationship, and consultation models. Let me tell you first how to make maximum benefit from this educational DVD. First, if you have a reference book, and I prefer to get a reference book and to read each session from the reference book before watching the DVD. If you have the course manual, and this is much more better, it will guide you while you are watching this DVD. Reading from reference and watching this DVD is just the start or the beginning of learning. To master new skills, you need to continue self-training, and you need feedback and rehearsal again. Try to practice these skills as a role play with your colleagues. This is going to be very helpful. Other things, I think you are very lucky these days. Video camera is available and very handy. If you manage to use video recording for your role play, and it will increase your self-awareness and enhance learning. This is my recommendation for reading. You can read the Arabic book, and if you have the manual, as I told you, it's going to be more helpful. This is a British book. The second one, the third book is American reference book. And you can read the Tate book, the Doctor Communication Handbook. It is extra reading, but it is very interesting and very nice to read it. What are we going to learn from this DVD course is not just to have touchy feeling and to be more humane, to have good communication skills with your patient. But improving your communication skills will make you better doctors. I will tell you my evidence. Research evidence show lot of studies answer these two questions. Let us start with the first question. Is there a problem? Yes, there is a big problem. Patient satisfaction. As you see here, 30 to 40% of patients are not satisfied with their physicians. Doctor satisfaction, even worse. If patients, 30 to 40% of them, they are not satisfied. Doctors, 60% of them. In international studies and in local research by Dr. Matbouli in Jeddah, she found 60% of doctors are not satisfied, and they have great job stress. Poor compliance. On average, 50% of patients do not take their medicine, or they take it incorrectly. This means 50% of our effort, 50% of the cost, it is just waste. Legal complaints. Do you imagine? 70% of legal complaints are due to poor communication. So if we improve our communication skills, we can avoid 70% of legal complaint. Waste of resources, as I told you, just poor compliance. This is old study. In 1995 in Canada and in 1993 in the United States, it showed how much it is expensive, this poor compliance. It cost Canadian people up to 9 million Canadian dollars, and it cost American people up to 100 billion American dollars, poor communication, and which lead to poor compliance. Patients complain of incomplete exploration of their agenda. They said when patients come to their physicians, they bring with them between 1.2 to 3.9 problems in each visit. But do you think doctors, they explore all these problems? No. Doctors discovered only 50% of their problems. In fact, doctors interrupt their patient after 18 seconds. They cannot wait more than 18 seconds, and they start to ask direct questions about the chief complaint. Doctors very often assume that the first complaint is the only one that the patient has brought. But in fact, patient has more complaints, as we said, from 1.2 to 3.9 complaints. No explanation. It is only 1 minute in 20 minutes consultation spent in explanation. Although patients, they need explanation. And their main complaint from their physicians that they don't explain enough for them. Physician lack of warmth and friendliness was one of the most important variables related to poor level of patient satisfaction and compliance. So we need to treat our patient with more friendly attitude to improve their compliance. If they don't like us, they will not comply with our recommendations. Okay? I think this is enough. Let us recap. Research evidence show patients are not satisfied, doctors are not satisfied, and there is waste of resources. There is a lot of waste of resources. Is there a solution? The good news, yes. There is a solution. Communication skills. That's why we are running this course. Appropriate communication skills helps doctor to feel less frustrated and more satisfied in their work. It reduces conflict and prevent misunderstanding, which is one of the main source of difficulties between doctors and patients. What can we achieve by communication skills training? Many studies over the last 25 years have demonstrated that communication skills training can make difference in all of the objective measurement of medical care. It is not just subjective. There is objective measures. Patient-centered approach. Greater patient-centered in their interview lead to greater patient satisfaction. When doctors have good communication skills and they concentrate on patient agenda, patients get more satisfied. Patient-centered approach in randomized controlled trials showed that such improving communication skills and have better approach with your patient, this by research showed better improvement of blood pressure control, better blood sugar control, better ulcer control, and in a recent study even better hemoglobin A1C results. So just by having good doctor-patient communication and adopting patient-centered interview. Discovering patient expectations. Discovering patient expectation lead to greater patient adherence to the management plan. And it doesn't necessarily you respond to all patient expectation, just to give him the chance to express his expectation. This makes him more adherence to your plan. Practice doctor-patient partnership if we treat our patient as adult-to-adult relationship. This sort of relationship make patient more adherent to our plan, because it's not going to be our plan anymore. It's going to be your plan and patient plan as you are work in a partnership with your patient. Shared decision. This is a very nice study for patients with breast cancer. They found that patients with breast cancer who are offered a choice in the type of surgery that they face, this lead to less anxiety and less depression after the surgery. Explanation. Patient satisfaction is directly related to amount of information the patient gets from his doctor. And do you remember, we showed you first, that in a 20 minutes consultation, only 1 minute spent in explanation. Although the patient, they come asking for explanation. They want to know what's going on with them. Decreased need for analgesia after myocardial infarction is related to information given and discussion with the patient. So if we discuss with patient with MI about his problem, this will make him more reassured, and he will not ask for more analgesia. Use of resources, and this is very important things. Involving patient in the decision making process was associated with significant less referral and less investigations. This suggests that doctor-patient partnership can reduce demand on the healthcare system. Let us recap. Improving doctor-patient communication, it is very important for patient care and satisfaction, for doctor satisfaction, and for effective use of resources. And this is very important, effective use of resources. All were proved by research. The message: there are a lot of problems in doctor-patient communication. Good utilization of DVD and continuous self-training, it will improve your communication skills, and it will make big difference in your satisfaction, in patient satisfaction, and in use of resources. Even if your communication skills is fine, this course will make you fantastic. Thank you.